Hello and welcome back. So, in this session, we are going to ask which term describes the avoidance of birthday parties because of an intense fear of balloons popping. Let's see if any of you know this. So, the term here is called globophobia. So, this is the disorder where you have this irrational fear of balloons popping. And in today's session, we are talking all about different types of anxiety disorders. So, let's kick it off with anxiety disorders. We're going to start off with a practice question. A patient fears leaving home due to worry about sudden panic episodes. Which disorder best fits? It's okay if you don't know yet. We're going to get there eventually. But is it A, specific phobia, B, social anxiety, C, agoraphobia, or D, GAD, which is generalized anxiety disorder? So think a little bit, and then we are going to continue with the topic. So, what are anxiety disorders? There are more than 10 different types of these anxiety disorders in the DSM 5 manual, but today we're going to focus on 5 core things that are most frequently seen on the MCAT. So, remember that anxiety disorders are most common psych disorder in women of all ages, and on the other hand, in men, the most common is substance use. So, that might be alcohol, cocaine, stimulants, opioids, kind of substances in general. So here are the 5 common ones we're going to talk about today. Anxiety disorders, we have generalized anxiety disorder, we have a specific phobia, panic disorder, agoraphobia, and social anxiety disorder. These are really good and key for you to know for the MCAT. So let's kick it off with generalized anxiety disorder. The definition here, it is an excessive, persistent worry about multiple things that last more than 6 months. So you have to be worried about work, school, finances, literally anything and everything you are worried about, and it has to last for more than 6 months, and it has to basically start interfering with your life in some way, shape, or form. You will see symptoms such as being fatigued, having muscle tension, particularly in the neck and shoulder area, having sleep disturbances, not being able to sleep or sleeping too much. And the key feature here is just worry is very generalized. It's not linked to one specific thing, it is about everything in your life. Every single aspect, whether you're at home, whether you're at work, whether you're at school, you're just worrying about everything. And so here you can see a nice little mnemonic for generalized anxiety disorder. It is miserable. So when you have this disorder, you're miserable. And M stands for muscle tension. I is irritable. S, sleepless. E, energy down. R, restless or on edge. And A is for attention down. You basically can't concentrate, can't focus. So miserable is generalized anxiety disorder. Now, the second disorder we talk about is specific phobias. So, here we have some form of irrational fear of a specific object or situation, and then this will lead us to avoid this thing. So, for example, you have claustrophobia, which is fear of closed spaces. So, maybe people avoid elevators, you might avoid caves, very tight, closed spaces that you do not like. Acrophobia is a fear of heights, which is also very common. So you might not go on hikes, cliffs, you might not go skydiving, bungee jumping, things like that. And then arachnophobia, fear of spiders. A lot of people are afraid of little critters, or me personally, I hate snakes. Like, even just thinking about the snake gives me goosebumps up the back of my neck. So that is specific phobia, and it can be about anything, and it is irrational fear of something specific. Now let's talk about social anxiety disorder. So in this disorder, we have fear of being embarrassed, fear of being rejected, or getting a negative evaluation in social performances in public settings. So you can think of the person that, has to go and do a public speech in debate class, or they're really nervous and like don't like going to parties because they might look not cute enough, not good enough. Some people are even socially anxious in terms of going to the restroom because it's a public space. So this is different from generalized anxiety disorder, because here we only get anxiety in specific settings, and that is social settings. So, maybe I'm totally fine at home. I'm not worried about finances or other things or my homework, but the moment I go out and have to give a public presentation at work or at school, that's when the anxiety ramps up. The next piece we're going to talk about is panic disorder. So, panic disorder is when all of a sudden, due to no specific trigger, you have an unexpected and recurrent panic attack. And then, because they're happening so unexpectedly, you start developing a fear that more attacks are going to happen, and you never know when they're going to happen. So you start basically having panic attacks and then having fear of having more panic attacks. So during a panic attack, majority of people have likely experienced panic attacks. It is a time when your sympathetic system or your fight or flight system is being activated. So it's almost as if a bear is chasing you, but in reality, there is no bear there. So you will experience things like sweating, you will start shaking, you might have chest pain, you might start breathing super fast. It might feel like it is the end of the world and there is a sense of impending doom, like you're about to die, or you might even think that you're having a heart attack. And so in these situations, you are experiencing the symptoms of a panic attack. So there's a really nice mnemonic for this panic disorder and the criteria for it. It is students fear the 3 C's. So if you have 4 or more of the following, you are likely experiencing panic disorder. We have students, so again, the physical symptoms, so sweating, trembling, unsteady, depersonalization, feeling like you're outside of your body, excessive heart rate, your chest is really like pulsing and beating really fast. You might be nauseous. You might start feeling like a numbing or tingling sensation in your hands, around your lips and nose, around your toes. You might feel like you are short of breath. And then finally, you have the fear. So fear of dying, fear of feeling like you're losing control, fear of going crazy, and the 3 C's, which is chest pain, chills, and a choking sensation. So you might exhibit any of these symptoms during a panic attack. So just remember, students fear the 3 C's. And next we have agoraphobia. So this is the fear of being in situations or places where escape is difficult. So people who have agoraphobia tend to avoid crowded places, public transportation, or just in general leaving home because they have this fear that if something bad happens, they won't be able to escape or get out of that place. And this disorder often occurs or coexists with panic disorder because remember, people that have panic attacks, they will then start developing a fear that more panic attacks will happen. And so people with agoraphobia basically have a fear that a panic attack will happen somewhere in a public location or in a location where they can't escape. And so then they will end up avoiding going out in public spaces in case a panic attack happens and they don't want to be in that situation because that feels even scarier. So agoraphobia is fear of being in situations where you simply can't escape. So you avoid going out and leaving home. You just stay at home, and that is agoraphobia. And here we go, high yield bridge points between psychology and biology. So there are medical diagnoses that can actually end up mimicking anxiety disorders. So things like hyperthyroidism, which means that your body is producing excess thyroid hormone, increasing your metabolism, and that then leads to symptoms that look or seem like panic or panic attacks. So these symptoms can mimic anxiety symptoms. So when we think of symptoms of hyperthyroidism, you can also have sweating, you can have tremors, you can have weight loss, anxiety, heat intolerance, you can have a goiter, which is like this lump in your neck. And so just remember that there are medical diagnoses and medical causes that can simulate anxiety disorders. But in order to diagnose someone with an anxiety disorder, it means we need to first rule out any other hypothetical or possible medical causes. And a high yield one is hyperthyroidism. And here we have it. Here's a quick rundown. So remember, generalized anxiety disorder, we are persistently, excessively worried about many things in life. Absolutely everything from work to health to finance to family to relationships. So worry about everything all the time. If you have a specific phobia, you have an irrational fear of something super specific: spiders, heights, flying, being trapped in tight spaces. So you fear one specific thing. For me, it is snakes. Social anxiety disorder. This is where we fear being embarrassed, judged, or scrutinized while we are in a public setting. Maybe we are at a party, maybe we are in a performance situation, performing with your symphony, playing the clarinet. So you're being afraid of judgment or of others evaluating you negatively. Next one, we have agoraphobia. Remember, this is often tied to panic disorder. We are afraid of being in places where we can't escape or we can't get help. So fear of escape being impossible. And the panic disorder, fear of having panic attacks themselves. So you're kind of like afraid of something happening. So you're having a fear of fear itself. And now let's go back to our practice questions. Let's see how much you are able to retain here. Remember our previous question, a patient fears leaving home due to worry about sudden panic episodes. Which disorder best fits? So in this case, we said specific phobia, social anxiety, agoraphobia, or generalized anxiety. Let's see what you think. And the answer here is agoraphobia. Remember, this is when we often have a panic disorder that is underlying and we simply are afraid of going out because of the fear that a panic attack might occur and we might not be able to escape. So we just like to stay at home. Question number 2, a 28-year-old woman avoids parties because she fears being judged. She is otherwise functional at work, does not experience excessive worry about unrelated topics. Which disorder best fits her presentation? Is it GAD, social anxiety, panic disorder, or a specific phobia? And our answer here is social anxiety disorder. Remember, generalized anxiety, you're worried about everything all the time. She doesn't experience excessive worry. Panic disorder is a fear of having a panic attack. And a specific phobia is one thing that is specific. So you could argue that she's afraid of being judged, but that more so meets social anxiety disorder. Now, if she had a specific phobia particular to just parties in general, or for example, clowns or circuses, then that might lean more towards specific phobia. But in this case, it's the fear of being judged or negatively criticized by people in social settings. Good work here. I hope the key takeaway is GAD, worry about everything all the time. Phobia, fear of one specific thing. Social anxiety, fear of judgment, rejection, or embarrassment. Agoraphobia, fear of escape being impossible, especially in public places. And panic disorder, fear of fear itself or fear of another panic attack coming on without you knowing when it will come on. Again, on the MCAT, pay attention on what is the thing that triggers the fear. Is it something general? Is it specific? Is it social? Is it escaping? Is it panic? What is it? And that is going to get you to the right answer. Thanks for watching. Don't forget to follow and subscribe. If this video helped you, hit that like button, and we'll see you in the next one.